All right. Well, welcome everyone. It's great to see you all. I know it's been a bit, a few weeks. How do the current matriculated IMP students feel? Do you feel like you're ready, or where are you?
I could
Same.
use another week.
Yeah, it's that too.
Same.
I feel like with everything that has been going on, we've been like prepping and didn't really take a break.
Yeah. Who originally said they felt like they could use another week?
Oh, that was me.
Oh, Matt.
Matt. Yeah.
Okay. Yeah. Oof. Um, how do you have a sense of at least your books and have some of the class shells opened up for you yet? Okay.
I think they're coming up soon. That's what they
Okay.
said.
Okay. I know that I opened up the folks that are in my section of professional role in nursing. I opened up the course yesterday. I'm teaching on Tuesdays and Thursdays, and it's partly to be um, so students can get themselves organized. And I know that you have orientation this week, so it's okay
Yeah.
if you don't get a chance to look at it.
Yeah, I think yours is the only one that's open so far.
Okay. I'll talk with the rest of the teaching faculty for at least the roles course and just make sure that we get that out for you, opened up for you. Um, I don't want this to be about me. We have students from the IMP program that are here to talk with you, some of whom have graduated. Others may still be in process of the program. So this is really for you to chat with them. And if there are any additional questions, I see that there's one about a parking pass that maybe students can't answer. Um, use chat and Amy and I will get those answers for you.
Yeah, I'll wait till the end and address the parking pass. But I'll let the current students take it from here.
Okay. And Janae, it's perfectly fine to feel nervous, by the way. One of the challenges that your cohort has not had is that you've not had the ability to travel to the campus and actually get a sense of where to park, where the buildings are. You've not had that wayfinding that other students have had, so that sense of nervousness may be there. You may have it now, and then when we finally get to campus in the fall, you may have it again. Okay, so I'm just identifying it um, for you that it's not unusual, and just prepare for it. Um, and then Kate, you asked if you need the professional nursing concepts, the access code. Do you have an old edition, Kate? Is that why you're asking?
No, I was asking just to see if could save money there. If you purchase it new, I believe it comes with the access code, and then if you purchase it used, you can still get it, but it wouldn't have an access code.
Yeah, you don't need that for my course, but I can't speak to the other faculty that are teaching, like Patho and some of the other courses. I believe in those courses you will need an access code. So if you haven't already, or they haven't made it clear, reach out to them.
Okay, thank you.
Yep, perfect. Hey, so why don't we let Maisie, Lainey, and Liz, and Emily just kind of, why don't you go ahead and talk with the students a bit? And
Maze, you should go first since you're the one that's graduated. Congrats, by the way.
Thank you so much. Yeah, so congratulations to getting in, guys. Like, yay. I guess it is kind of different from what Benini was saying. Like, I know that my cohort was able to go onto the campus, kind of see the layout of what the classrooms look like, the parking, stuff like that. And you guys aren't able to do that. So it's just a little difficult I bet anxiety producing for you guys. But yeah, are there any questions, or what should I talk about? The program is not as hard as you guys may think it might be. Just take it one day at a time. You guys are looking at like a really tall mountain right now, and you guys are at the bottom of it. So try not to look straight at the top of the mountain. Just look at one step in front of you and take it one day at a time. That's the best advice I could give you. What was the hardest part of the program? I would probably say the first semester was the hardest for me, just because it was getting into the rhythm of like a university class and classroom, because I came from CCD and it was much smaller classes. The information is a little intense, especially with pathophysiology. You guys will see that soon enough. It's doable, but I do think that the hardest part for me was the first semester, just trying to get into the groove of everything and switching from a community college to a university. Also, you know, trying to get all of my books and my scrubs. But after the first semester, everything was pretty smooth, pretty doable. You do have a couple of hard classes like MedSurg 1 and complex care later on in the program. But after you kind of get into the rhythm of how the classes work, it's much more doable. Let's see.
I totally kind of agree with you. That first semester, and Liz and Emily can definitely vouch that I've had to call them a few times to talk me off the ledge, because I was one of those students that I was like trying to see the top of the mountain and just take it one step at a time, because patho is a big jump from what you guys have done before. And you're starting a whole new way of test taking, and remember that it's a learning process, and don't beat yourself up about it.
Yeah, I will second that too. Like, don't look at the top of the mountain. We'll just keep saying that. You'll burn your class and you'll become so overwhelmed. You really just have to start from the beginning. And one thing the teachers will really enforce to you is like you're learning how things work. You're not just memorizing things. You have to really understand what it is that you're learning. So if you look at this big picture of something, you're just going to memorize stuff. You have to just start from the beginning, start at the basics, and just like learn that. When it comes to studying, like get together with your friends and like go over case studies and break down the information and understand it before you move on to the next thing. And don't just only focus on school. I just saw someone ask, like, did you take time for yourself?
Yes.
Oh my God.
Absolutely.
If you don't take time for yourself and spend a day hanging out with your friends and go exercise, like you'll go insane.
It's all about balance.
You're not going to become a successful student and a good nurse if you think the only thing you need to do is focus on school and nursing. You have to remember your life too, because you'll just burn out and your brain won't. You'll just burn out. So definitely focus on yourself too.
I think the biggest issue for us from going to community college is transferring to university, because I think a lot of our cohorts from CCD have already said like, holy crap, these pre-assessments are already intense and this is supposed to be our quote unquote break. So I think that's going to be our hardest part, is going from like a community college setting to a university setting. And I feel like it's going to be a lot more intense for us, like as INP students. And I guess a good question for all four of you is, did you work the whole time you were in school?
Yeah. Well, actually went down to part-time. Full-time was a lot. Working part-time is much more manageable, but I've done it the entire program. I think I'm also older and I have a mortgage and stuff like that, and I just simply couldn't not work. But I work in medicine too, so I kind of felt like it's helped me, like
Same.
able to put things together with what I'm learning, and then having those resources of asking. But to answer that, yes, I have worked.
It's kind of cool too, is that if you do have a CNA job, or if you work as a pharmacy tech or whatever, it's like you start connecting those dots. And like when you're learning about like electrolyte imbalances, you're like, oh, I know what's going on here. I just learned about that in school. Or if you do work in the medical field, take time to read your patients or read some of the patients' like history and physical. And eventually you'll start to be like, wow, I didn't know what that was last week, but now I know what it is this week. And when you connect it with like a patient, it makes it so much more memorable. And then you're like, oh, I remember that patient. That patient had like hypokalemia, and like this is what happens to them. And it's super, super helpful. So if you work in the medical fields, I feel like it was a lot easier to keep that.
Yeah, for sure. And on the other end, I was lucky enough to save a decent amount of money. So I actually didn't work as soon as I got to the university, because IMP, you have like a couple of semesters still at CCD. And then as soon as I got to the university, I actually chose to leave my job. And I was pretty comfortable. So I think if you have the option, definitely do it. It's not, available for a lot of people. I was very lucky. But it allowed me to study, allow more time for myself, and allow more time like for me to connect with my family, which just helped me like mentally through the entire program. But I know a lot of people that were able to hold down like 2 steady jobs during this program. So it's definitely doable. Working and doing this program is definitely doable.
I think
Liz is the like power machine of doing any type of like scholarships, but also working, but also going to school. So that's also doable too, is that if you wanted to get those scholarships, go get them.
Yeah, and I think with that, working in the medical field, you're going to pick up that time management portion, which unfortunately school cannot teach you. So if you can work, do it. But if you're finding that it's taking a toll on your mental health, apply for those scholarships, do those things on the back end. There are many ways to get through this program.
Students are asking, excuse me, on for tips on studying in the chat. That's been a couple of questions now.
Oh, sorry, you can go, Emily.
I get bored very quickly and easily, and I get distracted very quickly and easily. So I just have a plethora of different ways of studying. Like
totally.
Sometimes I would get together with my friends and we would just like go over things, or I would do case studies, or I would do Quizlet, or sometimes I would just take notes. Like that is maybe not a good answer because that's not very specific, but just like all these different ways of like reading and learning information really helps me like just understand them and put them all together. And it just kind of challenges my brain in different ways instead of just one way. Note cards were really helpful, quizzing each other, stuff like that.
Yeah, totally.
I've had to change my studying habits, I think, twice through this program, just because from coming from CCD to the university, I had to change my studying habits just because it's just more information, a lot more dense material. And then as soon as I kind of got the handle of that, I kind of tweaked it a little bit. So I just want to show you guys, if you can see this, this is a note card that I use. This is from pharmacology, actually. And I use color coordination. It really helps with like my photogenic brain kind of. So like yellow is anything that's important. Green is like the function of what I'm talking about is. I just have these like categories for each color. And it just helps me remember if I'm taking a test and I'm like, oh, what is a nitrate? Like I think, oh, well, what was highlighted in yellow? What was highlighted in orange? And it really helps me. Even to this day, I can still remember like some of my color coordination strategies. So that's my biggest tip for studying for you guys.
So mine changed also like 4 billion times. And I decided to change my studying ways when I was in my last semester at CCD. And I started using iPad, and I feel like that has really helped me the most. I love Quizlets, so I'll be making 300 Quizlets, which is also really helpful because like, say if you're on the bus, like you can just pull them out and do them right there. And like, you don't have a huge stack of note cards, and like, you can pass them on to your next like cohort or have friends that are going to do this later, it's helpful too, because most likely all of the same teachers will be there. But iPad, if you do have an iPad, I would strongly suggest getting Notability. It is super, super helpful for my organization because I'm kind of a nutcase and I'm all over the place. So all of my notes from my iPad get transferred to my computer, and you can record what they're saying as long as like the teachers are okay with it. And like when you're recording and while you're writing, you're like, why did I write that down? It's like you can replay it, which is really nice. And for me, I need to I listen to the lectures. I don't know, Liz, I would say we listen to them at least 4 or 5 times.
I go through and I make like little concept maps, and they're super tiny font, but it's everything from the lecture. And I just reframe it to be like, okay, why is this connecting to that? And then I go through and make like verbal study guides. So I'll ask myself a bunch of questions. And then I just go through and listen to them and be like, if I can answer all these questions, I'm good to go for the test. Notability is great. OneNote is also really great, and that's free with the Microsoft Office kind of suite. So I would say get an online note-taking system. If you don't already have one, try it out for, 1 or 2 sessions, see if you like it. And if you don't, then leave it and try something else.
Yeah. Yeah, I would say that we also, like after each segment, we would quiz each other. Quizzing helped me a lot. So if you have a study group, stick with that study group.
Yeah.
I know that I have, and that's been really helpful. Or, sometimes other people have different resources that you guys can swap, like your notes, just so you can get a different perspective on it.
Right. And I don't know if you guys know who like Hank Green is, but he has these crash course videos on YouTube, and they are flippin' amazing. Like for my pathophysiology, a lot of times when in class, like it just doesn't click very well because I'm a very visual learner, and he breaks it down into steps that is just so easy to understand. His name is Hank Green. You can also follow him on Instagram. He's just a very amazing guy. But his videos are called Crash Course. And they're just really helpful. I honestly don't think I would have passed Patho without those Crash Course videos.
There's been a few questions about like online resources. So to piggyback off of that, Simply Nursing is a really good one. Registered Nurse RN is another great one.
I don't like her voice personally, but
I don't like her voice either, but she does make some great stuff. And then Ninja Nerd is a really good one for Patho, just because it does do a deep dive into some things, which sometimes I need. So those are really great resources to kind of tap into, and they're all free.
Yeah, for sure. There's also Amoeba Sisters that you can use on YouTube. It's a little more like, kind of like elementary school, but it really like puts things into like really simple terms for you to understand. So Amoeba Sisters is also really, really good. They don't have a lot of videos over a lot of stuff, but the videos that they do have, it really benefited me.
Yeah. So someone asked, well, any tips to be successful this summer? And well, I guess the one before that, like your virtual clinicals, how do you guys think because I don't know, Maze, did you really have to do very many of those?
Yeah, I did actually. So I had to do virtual clinicals for actually OB, so labor and delivery, which was really interesting. I was basically just pressing like the push button for, however long, but it's interesting. It's very different. It's not hands-on. I kind of like to say it's kind of like learning how to drive a car online. So really try to understand what the virtual clinical is trying to teach you, because although you're not doing it in real life, it's seriously almost exactly like real clinical, but it's just online. It's a little different. Like if you don't do the steps in a certain order, it'll tell you that you did it wrong. So it's a little frustrating, like with the online vSim, it's a little frustrating, but it's totally doable. I honestly liked it because it allowed me more time for myself, honestly. I would wake up early and I would get the VSIMs done by noon, and then I would have the rest of the day to myself. So it was nice on that end. But other than that, I didn't really have any problems with VSIM. I actually kind of liked it.
Me and Liz just ended our mental health clinical, and those VSIMs online, chef's kiss. That was amazing. They have actors come in and specifically act out like patients with schizophrenia or bipolar disorder or like borderline disorder. And it really gives you that chance to really, have those conversations with people that have studied those types of disorders without, freezing up in person, because it can be really difficult sometimes.
There was a question on how test taking is different. So with these tests, you will have professors that have what are called NCLEX style questions. And those are a lot of select all that applies. They will become your nemesis in many ways, but they do make you think. The other thing is a lot of these online tests, they'll be like, you have one question and you go forward and you can't go back. So that's kind of how the test taking is a little different.
And they also have, I do remember at like CCD, it was like two of the answers were like obviously not the answer, and it was like one specific one is, the right one. Well, when you go into university, it's going to be very different. It's going to be like two answers, or maybe one answer is not right, and then there could be 2 or 3 answers that are like completely valid, and they could, totally be the answer, but you just have to start thinking correctly. You need to start thinking in the way that NCLEX wants you to think, basically. So through these courses, you guys will kind of see like a pattern in the questions, and you'd be like, oh, I understand this. Like my first semester, I was like, what is NCLEX doing? I don't even know. But now I'm like, I am ready to take this NCLEX. I understand the questions. And I did see that Benini said that faculty is also a great resource. I cannot tell you guys how important Susan Benini was to me, Dr. Benini was to me, my other advisor, especially Amy Sturrock, was to me. I mean, I honestly don't think I would have gotten through the program if I hadn't have gone to Benini's office a couple of times and just totally broke down and cried. I mean, she is a great resource. She is 100% on your side, and I just love her with all of my heart. So please, if you guys ever need anybody, do not be hesitant to reach out, because they are more than welcome to help you.
And I also want to comment on that. Thank you, Maisie, Mrs. Amy, that we've got 2 dedicated teaching assistants that are there for tutoring that we have not had in the past. So they are there for students this summer and this fall. So yes, definitely use your faculty, but we also have designated TAs to be helping students this summer and fall.
Yeah, definitely reach out to your resources. Dr. Connolly was my person to go to if I didn't understand something. And she would take the time to, sit down with me over Zoom and like work through stuff. So talk to your resources. Any tips on balancing life with school? I would say set a schedule for yourself. So like I wake up at like 7 or 8 each morning, I work out, and then I okay, I have this stuff to get through today, and then I can take a break. But kind of find a schedule that works for you in your life, and try to stick to it. It'll make the routine a little easier, and then you can feel like you can get your feet under you, especially during front loading and also adding in clinicals.
I became a psycho person with my planner, like a paper planner, color coordinated, hourly. Yeah, we all of us. Yeah.
Well, the one that me and Emily have.
Having it in my phone, I have to have a paper planner with everything written out. Each class has a different color. Like, I just write down every single thing that comes to mind that I need to do in my personal life or school, everything. And that really was critical in me like staying on track with everything. And I would like literally pencil in time like for my personal things, like between these 2 hours I'm gonna go to the gym, or these 2 hours I'm gonna have a drink with Lainey, or like something like that. My paper planner, I like Day Designer. I get it at Target. I highly recommend. It has like every day, all day long, probably 20 pounds, but it's the best. I use it to prop up my laptop.
But what's great about that planner is that it gives you that option to go hour by hour, and you can plan it. Like she got me onto it because it lets you, like, the night before I'll be like, okay, this is when I'm waking up. This is how I'm going to plan out my day. If it kind of gets messed up, let's just get back on track. And I definitely would recommend, and Emily also did this for me, is that on your phone, always set a good night and like a wake up time where it like shuts off your phone. You like, basically it's like telling you to go to bed. Like, don't touch your phone and just go to bed. That was really helpful. And I guess that kind of like ties back to Kathy's question. On average, how many hours do you sleep every night? I'm a really bad person to answer this because I work night shifts. So I won't be answering this because I think I've had like an hour of sleep today.
Oh no, my
goodness. Like minimum 6 hours of sleep. I am not a functional human being. So I prioritize sleep. Like, my studying is important, but so is sleep to me. If I don't sleep, I'm not going to work. I'm not a person that's going to pull an all-nighter just to try and learn more, because it's pointless. So if sleep is something that matters to you, make that an important thing in your life. Like, don't sacrifice it just to study an hour longer. It's not going to help your brain. So
right. I definitely try to get about 8 hours of sleep a night, especially when I was in the program. And for me, the easiest part, especially since, I didn't work and I wasn't on night shift, I went to bed at like 8:30 and I would wake up at 6. And a lot of times I would go into school early, like about an hour early, and I would look over the notes and the content that we were going over previously, before the class started. And I found out that it helped a lot. Just kind of preparing myself for the class. I obviously already read the chapters and everything, but I went into more depth. So it was easier for me to understand when they went into lecture. So that's something that I would encourage you guys to do. It also just made me feel like I was really ready for the class. Like I hate feeling like I'm late. So if I feel like I'm late, it just makes my brain very foggy and I'm like, well, I'm not really here today. So being on time is also really important. And it's like respectful. It shows respect for the teachers, obviously. So yeah.
There's a question that it says, Alicia, how do you recommend getting over perfectionism? I would say that Patho kind of did that for me. Is that I was a straight A student for all of IMP, and like basically me, Liz, and Emily were very much like we were kind of devastated if we did pretty bad on a test. And like once you get to Patho, it's just like it's a totally different way of learning system, and you're trying to figure out what kind of learning system that you need to do. And I got my first B. I cried about it, but I cried almost every week, but that was just me. Some people thought that Patho was really easy and Pharm was really hard. It's all just very, very different, but C's get degrees.
That's what I'm saying. I actually told myself that a B in nursing school is an A in real school, because I mean, I was also just like Lainey. I was a straight A student, and I got my first B in Patho, and I had a breakdown, and I was like, this is not okay. I am a full straight A student, and this is not the expectation that I hold for myself. And I lowered my expectations, and my anxiety went way down, like way down. If you expect yourself to get an A, you are gonna have a rough time. Like, it's okay to get a B. A B is an A in my mind in nursing school, because
absolutely, give yourself some grace.
Yeah, and also be kind to each other. This is a hard program for everyone. If you see somebody struggling, say, hey, what can I help with? And even if it's just 5 minutes of ranting, I would call Lainey and Emily constantly to be like, I just need to rant about this for a second, get it off my chest, and then keep moving about my day. If you have mental health issues already, I would say if you have a primary care physician, talk to them, say, hey, I'm starting a new program that's going to be really stressful, and just kind of keep in contact with them. If you need therapy, get it. It's great. But really take care of yourself and each other. This is a hard program.
Yeah, I remember at the our INP meeting so vividly, Benini being like, this is not a competition anymore. Like everyone,
You already made it.
for one, yeah. Cohort now. Everybody is in the same, you're not fighting each other, you're just all in it. And just remember that and like help each other through everything, even the tiniest of things. You're all
That was like, that's burned in my brain too. Any well, I guess we kind of went over time management tips, but anybody else have any extra?
Yeah, I something that really helped me to do is every Sunday, I would plan out my week. And of course, like some things would change during the week if like something came up, but I would write down my school, like my class times. And then as soon as class ended, I would normally study for about 4 hours just because the information was fresh. It would really sit in my brain. And then I would just literally day by day, I would set up. So I would start on Monday and then I would go to Tuesday, and hour by hour. That planner that Emily has is great, but I didn't have that. I would just write it down on a piece of paper, and it helped me out so much. It made me force myself to take breaks, because if I didn't, I mean, honestly, my anxiety like almost sometimes didn't allow me to take breaks. But just planning out like day by day, hour by hour, helped me so much.
So I'm sorry, I may pronounce her name very badly, but Tatiana, she said, did you all read the Patho book a lot? Yes.
Mm-hmm.
Yes.
Patho book is an important book to have.
Yes.
Very, very, very much so. The books that I bought that I use almost every single day interchangeably within my classes is the Patho book, the nursing diagnosis book, because you're always doing nursing diagnosing books, and you're going to do care plans once you go to your clinical. And then I also bought my the Davis Drug Guide book, and I have it also on my phone, which is really, really helpful. Those were the three and I think I also bought the farm book.
I have a question to Lainey. You said you have the Quizlet. Do you have it publicly, or I can find it, or no?
I'm gonna kind of check to see if that is after we answer a little bit more of these questions, but I can check to see. I know that towards like after Patho, I kind of trailed off of Quizlet, but that's how you know that your studying style will change.
Someone said tips for having little kids. I know Liz, Lainey, and I don't have children, but there are a few people. Someone in my clinical group has kids. So yeah, I don't really know our I guess, but like finding other people that do have kids and just kind of talking to them and see like what I guess works best for them. Her scheduling is definitely a little bit different than mine, how she plans her day. So I would.
Yeah, I was going to say those of us with children, at least at CCD, have kind of like formed little bonds because, you know, we can only kind of relate to each other. But anyone who does have kids like me, I have a 6 and a 10-year-old almost, so they're fairly young. One of them is also special needs. So this semester having them home is going to be, thank God it's online. But anyone who has kids that isn't from CCD, like I'd be so more than happy to give you my email and let you know, like join our study groups or whatever. I do feel like as a parent, my time management skills are pretty much on point. I don't really have an option to not have my time management pretty much laid out every day. So I think I can help a little bit with.
That's great.
Yeah, use each other as resources.
Yeah.
Always.
Yeah, that Mandy, that's very kind of you to offer that out. And in the past with the IMP students, we had a woman, gosh, probably about 5 years ago, who had 7 kids. And what they did was, which I can't even imagine, but what the students with kids did was exactly what you're suggesting, where they created their own group. They even did a share of babysitting resources, and even did like this food exchange where during breaks they would create foods like things that kids would eat, like mac and cheese, whatever kids would eat, and then they would exchange the food, and then they'd freeze them, and then the kids, all they had to do was take, a container out, microwave it, and then they had their meal. It was so interesting how creative these students were. It was just amazing.
Yeah, I don't know. I like maybe Maze, you can probably speak for your group too, but for our IMP group, I just really, these are like my forever people. I don't know why, but we just really like bonded with each other. So we've actually stayed in really good contact throughout all of like CU process. And we kind of do little check-ins, which is really nice, or you'll see them on campus and say hi, or even at clinicals. And it's nice to have that. Like, I feel that we had a huge leg up with IMP, because think about all the other people that they have no idea of anyone that is like in the program that is just going into it regularly. You guys already know each other for a year. So use that and be able to like lean on each other, because that leaning definitely helped me when I was having those anxiety fits or doubts, which definitely will happen, is that, you can call someone and be like, yo, bring me back to reality.
Yeah,
you're going to be okay. You're going to be able to do it.
And with your clinical group too, just like
Yes.
it's really important to like have a relationship with each other, have a group chat or a WhatsApp or GroupMe or something that, like, my clinical group, same thing with Lainey said with IMP, like we were very close automatically, but my clinical group too, we were all instantly very good friends. And every day during school, we'll wake up and be like, hi, what's due today? And then we keep each other on track with that. And it just form a good bond with each other, because you'll realize how important it is and how much you're going to lean on each other.
I always say to people that my clinical group is basically my family now. I mean, the amount of reminders that they reminded me and I reminded them, I am just forever grateful for them. And I did post in the group that for mothers also, in your IMP group, reach out to the students that may not have kids, because I remember I babysat for a couple of the mothers in my IMP group, because they just, they were like, I need to go to the library and I really need somebody to just like look after my kid. And I'm like, yeah, I got you. Like, go to the library for 3 or 4 hours. Like, I can totally watch your kid for you. So also, keep in mind that you have other people in your IMP groups that are willing to help you, hopefully.
Since all the IMP groups are on here, I'm just wondering, like most of the CCD groups were colored in orange. I'm just wondering if that happened with the other IMP groups in here, what colors like Red Rocks and CCA got into?
So I know for us, we were all split up, and that was one of the suggestions that we made, is that we asked that, try to cohort these groups together, because it was so impactful for us to have friends. But yeah, so Red Rocks is in green, it looks like.
Yeah, so the reality is This is Dr. B. When the IMP program was smaller, we were able to cohort the students together, not necessarily in clinical groups, but we were able to at least move them in class together. And as the IMP program grew, it's impossible to move 60 students to, or even 15 at a time. And certainly your clinical groups are much, much smaller. And so we try and do the best that we can to get as many of the students in similar groups together, but it doesn't always happen. And you know, just keep in mind that our intention is to keep you together, but it just doesn't always happen.
Also,
honestly, we thought we were all going to get split up into different color groups. So at least CCD seems to be mostly in orange. So except for like 2 of us, I think. So we're pretty lucky in that because we've already helped each other so much the last couple of semesters. And yeah, we have a pretty strong group going. There's a group chat about 14 of 18 of us that we talk almost every day. So if anyone wants to join,
you are all in orange.
That's
no, like 16 out of 18 I think are in orange. I think there's only 2 that didn't get in orange with us, but yeah, most of us are in orange, so it kind of helps with the studying.
Yeah,
even those that are sorry, Emily, even those that are in different groups, save your notes, because I pass notes on to other color groups for the stuff that I had before, and I've seen their notes for the stuff I have coming up. So save your notes.
I don't know how the clinical groups were assigned. It was super random.
Yeah.
I feel like the people that were, because I was in one clinical group and then a girl dropped from my group and they kicked me out of my group and then they put me into another group, which I'm very grateful because I love them. But I feel like that happens a lot, and don't be discouraged, and you'll do great.
Yeah, and Lainey, you bring up a good point. The clinical groups are relatively random. Again, they do try their best to keep the IMP students somewhat cohorted together, but if the numbers are odd and we need an even group, someone inevitably gets kicked out. The other piece that I want you to keep in mind is that you're going to be working in groups and teams of people you may or may not know throughout the rest of your career. So the other opportunity here is for you to mix the cohort up and get to expand your group of colleagues and helpers, right? Your support systems will grow. So while it may feel uncomfortable, there are some benefits as well that the students have identified.
And I would say for the workload for INP, I would say it was a little bit more specifically in front loading. And if you're not familiar with that term, that essentially they compress quite a bit of the didactic or the in like classroom learning to the front half of the course to leave more time for clinicals in the back half. And that was like drinking information from a fire hose for the first couple of weeks. But afterwards it felt pretty similar.
Yeah, you'll kind of get used to that. Like first time you experience that, you're gonna be like, I'm going to die a slow death in this program. But then that's not what happens. You just get like all this information for like a couple weeks, and then the rest of the semester is much more manageable, and then it'll happen again. But don't freak out. Like it's gonna be intense, and then it'll get better. But it's not just intense the entire time. It'll be okay.
Take it one day at a time. Don't look at the top of the mountain right now, because that is just going to make you so overwhelmed.
Yeah.
Take it one class at a time, one day at a time, one exam at a time. I mean, you guys got into the program so far, so you're all very, very smart and capable, and you guys are definitely going to be definitely able to make it through this.
Absolutely.
1000%.
I definitely bought the book bundle. I don't know. I think a lot of people in my cohort bought the book bundle. I wanted to buy it just because I like to read. It really helps me with learning. And also I just wanted the books after nursing school because I don't know, I like books and I like to keep them. And I was like, hey, so if I have like a question about pulmonary embolism, 5 years down the line, I'll have this book and I know, everything about it. So that was kind of my, thinking about getting the book bundle. But again, a lot of people didn't get the book bundle. It just was easier for me because I already had the books when the class started, and there were a lot of people like, frantically trying to get the books like when the class started or a couple weeks before the class started. And a lot of times they didn't get the books in until like 2 weeks after the class started. So for me, I just liked having all of the books at the beginning. And also I was able to look through some of the chapters even before the class started, which I really liked. I like to get started on stuff like right away. I'm not a procrastinator. So yeah, I would definitely advise you guys to get the book bundle.
I'm the opposite. I hate reading, so I did not buy a book bundle because I didn't want to have the books. I've just rented them for each course. Some of them I bought. I definitely have the patho book. I have the med-surg book, the nursing diagnosis, the drug guides. Those I will keep forever. But I also found that I could rent them or get them like online for free even. You can find PDF versions of almost anything in the planet.
Yeah.
So for those of you that don't have the book bundle, or that's just not something that you feel like you're going to do, you'll still be able to get the books. Just so yeah.
Yeah, it's nice when you get because I get the ebooks, like all of the books that I have bought, that they're on like one app, and it's like basically like a bookshelf anyways. And I try to and it's just right there. And for me, it was a lot easier, especially doing like med cards and like care plans and stuff like that. It was easier to have it both on my computer screen for me.
But get the patho book. Own the
patho book.
On the patho book.
I want that.
I have to say ebooks have been probably the easiest way for me because I can literally just put everything on my tablet and I can access it anywhere if I have a question. Or if I'm like, I don't really remember how that worked, let me look that up real quick. So just find what works for you.
Yeah. What works for some person might not work for you, and that's okay.
Yeah.
How are you guys feeling? I know that you guys are like starting this new chapter in your life. Are you guys excited? Are you guys, just feeling a little bit of that nerves or?
That you guys are very nervous. I know I was.
Most of us are nervous.
That's okay.
But I got my CU scrubs the other day and I got so excited. Like I put on my scrubs. I was like, I'm going to be a nurse. Like this is amazing. I got really, really excited after I got my scrubs.
That was a big moment for me too. Yeah. And I cried. I cried a lot. But yeah, it's like that big moment, like you made it.
For those of you that feel like overwhelmed and nervous, I went camping like the week that we had our online orientation. I was like sitting in a tent with like random Wi-Fi from like, I was in the middle of nowhere and I just had this complete mental breakdown. Like my boyfriend and I hiked up to the top of the mountain. I like lost grip with reality. I was like, I can't do this. This is too much. I'm never going to see my family for the next 2 years. Like they told me to like say goodbye to you. Like this is going to be terrible. And it's not. It's going to be great. It's going to be a lot more fun than you think. You're going to learn so much that is going to be so interesting and so cool. And you're going to meet all these cool people and you're going to have clinicals and get to go to other hospitals and like see babies be born and like really cool things. And it's overwhelming because you're just staring down this very long road and that's all you can really see, but one day at a time, and it's going to be fun and you're going to make lifelong friends, and before you know it, you're going to be graduated, or you're going to be like us. We've got less than a year left. And you're going to be like,
I know.
So
yeah, honestly, it still hasn't sunk in for me that I'm done with the program. I just graduated last Friday and I'm still like, nah, I still have like 2 years left of this program. Like guys, it goes by so quickly. Like I feel like I blinked my eyes and it was done. So it's, yeah, you guys are going to be able to do it. And I just saw, a wonderful question from Hannah. what student organizations would you recommend joining, if any? So we just started a new organization. It's called Future Voices. It is equity, diversity, and inclusion. Basically, we try to stop the systematic racism and kind of things that are in place to kind of not truly help these people that are that might be less fortunate than us. Basically you just have to attend one meeting a month. There's multiple meetings a month, but in order to be a member, you have to attend one meeting a month. And it's just, it's been mind-blowing and mind-opening to me to see, you know, how much institutionalized racism there is just in healthcare. And with you guys starting out, I think being a part of that group would be absolutely amazing, because it really can make the difference to a patient that might be in like a diversity, or somebody that might be, you know, in a lesser, I don't know what I'm trying to say, a lesser minority. And the Dawn Clinic is also amazing.
Yeah, I just did my orientation for them, and I'm super excited because you get to work with all different types of groups, and you can kind of hone in to where you kind of work with. Because personally for me, I'm super interested in SANE nursing, which is sexual examiner nurse. It's kind of like dealing with trauma within, like, you would be like a trauma nurse, or you would be like an OB nurse, like specifically, but also you would be a SANE nurse, where you help people that are victims of sexual assault or sex trafficking or domestic abuse or anything like that. And they offer so many different types of like individual help for people that, like, this healthcare is free for them, which is, love that already. But yeah, you can kind of hone in some of your specialties and be able to, you know, really perfect some of your skills if you're not deciding to do like an ACP position or something like that. But yeah, you can work together within like a community with like med students and pharmacy students, and work together and work on a case that may be LGBTQIA plus specific, or a like a domestic abuse issue and stuff like that. So it's been really helpful so far, and I'm really excited for that. So.
And you guys will learn all about this stuff on Friday. And if you feel overwhelmed by all the information, because I certainly did, you know, stash those email addresses for the people that come and talk and say, and when you feel a little bit like, okay, I have my feet under me, contact them again. That's what I did for CUSNA, and same with Future Voices. So there's so much opportunities for you guys to have networking and talk to people from different specialties. So take advantage of it while you can.
I wanted to say too, Lainey had very briefly mentioned ACP things. This isn't about the organizations, but once you pass med-surg, you guys will be able to work as an ACP, or depending on the hospital, it could be a nurse extern, nurse tech, depends on what hospital it's at. But if you are able to try and get one of those positions, it's not easy. I work at Littleton Hospital, and we're called nurse techs there, and I get my butt kicked every shift, but you will have such a great opportunity to learn everything about nursing, like under a nurse in a controlled environment. Like we get to do IVs, Foleys, blood draws, you name it, we get to do it. The only thing we can't do is pass meds, and it's a really, really good opportunity for you to just like get in there, to network, to learn things. By the time you graduate, you're just going to feel so much more confident in your ability to take care of patients. So if that's something that you're able to do, I really encourage you to do even like a PRN position, just a couple shifts a month or something.
Yeah. Emily talked me into it, so.
Yeah, I forced Lainey into it. Now she's going to come work with me, so. Yes, you should do it.
For that program, do you have to have like a prior certification?
No. Once you pass med-surg, you have to be done with the class and have passed it. Then you can do it. You don't need to have your CNA license, anything like that. If you're already a CNA, you can talk with the hospital you work at, and they, like for a Littleton, they will move you up into that role. But it's not required to have your license.
Yeah, unfortunately, me and Liz both work at Denver Health, and I work at Littleton Adventist now. But yeah, Liz and she probably has a lot more kind of leeway in her job because she works in the SICU. But at my job, I didn't really have those opportunities. It was basically like I was sitting with patients because they were acutely ill with eating disorders, or like you could do CNA work, but there wasn't really very much that I could progress at Denver Health, even though I love Denver Health to the bottom of my heart and I want to work there. But yeah, Littleton Adventist was an opportunity for me that I couldn't turn down, you know.
And I think for me, since I'm in an ICU, I get to see a lot of those procedures that don't really happen on the floor that often. So that's why I stayed there. But if you can get an ACP position, do it. It's just more time under your belt doing those tasks and things that you may feel like, I kind of don't feel that great about it when I'm in clinic or in lab, but you get more time with it.
And what's also great about that is that one of me and Liz's and Emily's friends, Gage, he got an ACP position in his, like, he wants to be in mental health, and he like basically got a straight shot into a nursing job right there. Like, if you think about it, like if you're working as an ACP somewhere, they're going to look at you and be like, oh, we know you're a hard worker. We know, like we already know how you work.
I have less than a year left, but I'm not planning to stay and work on the floor that I'm on, but they've already offered me a nursing position. So that's something to take into consideration. Like it's basically a working interview, and most people get hired on. So
working as an ACP, do you get offsite clinical hours for that, or?
No, that's different than your clinicals. This is just my job. I'm employed, I'm paid. It's not anything through the school. So you'll have separate clinicals.
Yeah.
So just a quick note about that. Any paid clinical is not considered part of your school program, and that's really from the State Board of Nursing.
When would you start? So I started as soon as I finished med-surg. Like as soon as we finished, I applied for it. It's med-surg. So once you finish that, I applied.
I wish that I would have done it earlier, honestly. Kind of kicking myself for that one. But
so many of the programs will start on certain time frames. Like they'll start some in December, and then there'll be another one in February. That's UCH. Excuse me, but other hospitals have other times that these programs will open up. So if you miss it the first time, don't worry, you could catch it again.
And be on the lookout for openings. I really love trauma ICU. That's where I'm at, and I love it. So if you have a specialty, if you really love cardiac, there's ACP positions, I believe, at the CTICU over at university. So keep an eye out. Take a look when they send the emails out. Just be aware.
Okay, it looks like we only have a few more minutes. Any last minute pearls of wisdom that the four of you could lend to the students?
Yourself grace.
Yeah.
You're a student, you're learning. Don't beat yourself up about things. Like just take every chance as a learning opportunity. If you get something wrong, just learn from that. It doesn't mean you're going to be a bad nurse in any way, shape, or form. And just soak it all in and give yourself time to yourself too.
Yeah. I didn't really feel like I was a competent nurse or student until I was in my second to last semester. I literally woke up one day and I was like, man, this all makes sense to me now. For the first year and a half, I was like, I just don't know if this is for me. And then one day I woke up and I was like, wow, I now understand it all. I'm going to be an amazing nurse. Just give your guys self affirmations. A lot of times in the morning, I would look at myself in the mirror and I'd be like, you are awesome. You can do this. You're going to be an amazing nurse. And have that support system, have your friends, have your clinical group, have your family be there for you, because, support systems were just absolutely incredible for me during this time.
Absolutely.
kind to yourself, for sure, for sure.
I would say during clinicals, don't ever say no.
No.
Just say yes. If you don't feel comfortable doing it, you can say no, fine. But what I'm saying is that if by saying no, you're missing out on that opportunity, you know? And like sometimes you won't get those opportunities. So always say yes.
Even if you're uncomfortable, just you can say, hey, I feel really uncomfortable doing this, but I'd really like to. So can you like just, hover over me while I do it, because I'm not sure if it's going to be, if it's going to go exactly correctly.
Yeah.
And all the clinical preceptors that I have had have been absolutely incredible.
Yeah.
They want you to be the best possible nurse that you can possibly be. So they are like a gold star in my book. Like,
Same.
absolutely amazing.
I've gotten a few references from mine and I love them. I
And
still
tap
check
them
in
as
with them.
mentors. Yeah. Definitely tap them as mentors. I still talk to my MedSurg 2 clinical preceptor almost weekly, just doing a check-in with her. So if you find somebody you really connect with, get their contact information, get their cell phone number, say, hey, I would really love to use you as a reference or a mentor. Use your resources.
Yeah, clinicals can be super overwhelming. So after learning a few of those, I realized that the best thing is to do is set an intention for yourself that day. Is like, what do you want to focus on? Do you want to focus on med passes? Do you want to focus on IV push, or kind of set that goal for yourself each day and don't get too overwhelmed with everything, because it can be overwhelming.
You guys made it this far.
You got it.
You guys got this. Seriously.
You're going to do
Those are
great.
all wonderful.
So I just wanted to chime in real quick. So I think, that's probably the close of the IMP session. For those of you students who are just coming on for the 1:00 session, we'll also have a student panel, a Q&A session on Friday. I know you've been hearing some of the advice of these current IMP students, which is phenomenal. But I did want to just comment on the question somebody had about the parking pass. So, as we get closer to fall, you'll get information about options for monthly parking passes that are tied into your badge. And in the meantime, really, if you're coming to campus, just pay for hourly parking in a number of different lots. I mean, it's $1 an hour. So there's no need to get a parking pass until you're going to be here kind of consistently. And even sometimes students will still pay for daily parking. I mean, it's kind of a preference. It is a lot more money to do that. And I don't remember off the top of my head what the fee is for students. I mean, it's a little bit, a lot higher for staff and faculty. But that's something that, don't worry about it yet. You'll get more information before the start of fall. And Dr. B, do you want to say anything else before the session concludes? And once Dr. B is done, IMP students, we got a little bit of a break, and then we're back on at 1:00 with the next session.
No, I think that's a perfect place to close. I can't thank the current IMP and former IMP student for coming and spending your time today and helping the students get a sense of things, because their approach in this program has been very different than yours. And while they'll come to campus starting in the fall, it's going to be a little bit different journey. But thank you so much for your kind advice and for your tips. And I hope to see everyone in the fall. Maze, I am so proud of you. Enjoy and good luck getting into the NICU. Stay in touch for sure. And Liz, Emily, and Lainey, please continue to do as great as you are. And yeah, it's awesome.
Yeah, thank you so much, Maisie, Lainey, Liz, and Emily for being here. We really appreciate it.
Yeah.
You guys.
Thank you.
Yep. Take good care, everyone.